Hi guys, and welcome to DVT Basics. My name's Steven. Let's get started. So first off, you're going to be using the linear probe for this exam. You're going to start out with the probe just below the patient's inguinal ligament on the side of concern with the indicator pointed towards the patient's right. So we're going to be looking for these vascular structures all the way down. Pocus101.com actually has this great infographic. I really recommend checking out their website. They have a lot of great infographics on a ton of different topics, but this one goes over the different spots where we're going to compress for the different types of scans. Normally in the ED, we're going to either do 2 or 3-point compression scans, whereas if you send the patient to a vascular lab, if you have one of those at your hospital, they're going to check the whole leg. So we'll talk more about the significance of all of that in our pathology series, but for now, just know that you're either going to be usually doing a 2 or 3-point scan in your emergency department. So the first thing is to identify the anatomy. So I use navel to remember this, and that is to remember all the structures from lateral to medial. So it's basically right here you have nerve, artery, vein, and then empty space and lymphatics. So that corresponds from lateral to medial, navel. So when we look at it on the ultrasound, what we're going to see just below the inguinal ligament is the femoral artery and the femoral vein. So here we have the femoral artery, and here we have the femoral vein. So this is actually the first point of compression, and I'll show you guys right here. We're looking for this thing right here, which is called the saphenofemoral junction. And what that is that's the great saphenous vein actually taking off superficially from the femoral vein. And we see that on the ultrasound right here towards the end of the clip. You see that vein coming off anteriorly. That's the great saphenous vein. So you want to go about 1 centimeter above this and compress, and 1 centimeter below this and compress. And if the vein is 100% compressible, that would prove to you that there's no DVT present in that area. So this is the first spot for the 3-point compression. Now, if you're doing the 3-point, next you're going to go to about the mid-thigh, and you're going to look for where the femoral vein splits into a deep and a superficial, and you're going to compress there. So what that would look like is you see femoral artery here on top, non-compressible, and right below that you have the femoral vein. I usually like to just kind of compress the femoral vein all the way down as I go to make sure there's nothing abnormal, and then about midway through, when I see something like this, I record a clip there. The last spot we're going to go is to the popliteal vein. So to get the popliteal vein, you really have to prove to whoever's watching your clips that you shot it all the way through. So to do that, first you find a shot like this where you see popliteal vein right here on top of the popliteal artery, and you just compress it like they're doing in this clip. And then you have to show the trifurcation of veins. And basically the trifurcation of veins is the end of the popliteal vein. And that shows whoever's watching your clip that you made it all the way through. And here we can see that the vein on top of the artery up here actually splits into 3 midway through the clip. And that would just prove to whoever's watching that you imaged the popliteal vein all the way through and you saw no clots. So like I said, we'll discuss the ins and outs of DVTs a little bit more in the pathology series. But for now, go out there, have some fun, and look for some clots.